morning. Okay, so today we're treating our Suke and returning patient. So we've treated him with multiple sessions of RF microneedling, subcision. Yes, he was brave enough to do that for his first session, and also a couple of fractional CO2. So we've been targeting the top layer of his skin, but now as you can see, let's zoom in. He is left with box scars and some rolling scars. So for this one, to go down to the details, we will be doing TCA cross to actually lift those deep scars. And after that, we're going to do some resurfacing and tightening with RF microneedling. Let's go! Okay, so we're starting with TCA cross. So TCA cross is still the gold standard for very deep scars such as box scars and your ice pick scars. It's not an instant, I have a few patients who actually enjoyed the first session right away. But as I tell my patients, it's about injury and repair. So that's how scar revision really goes, injury and repair. So for this one, I use 80% TCA solution. And we gently just drop it. So as you can see, we're done with our TCA cross. So initially, it's normal to see the erythema and swelling around the areas that we dropped our solution. That's just because of the heat, and of course, it's a high concentration acid. But after a few hours, wala na yan. And then these white spots will actually become brown or magsascab siya after 3 days. And it starts peeling off around, depends on how oily you are, but usually around 5 to 7 days, wala na yung scab. But our next procedure will be the RF microneedling. So that's radio frequency. You get two benefits in one. So you have your radio frequency that targets around your dermis to tighten and produce collagen. So tightens and produce through heat energy. And of course, you have your microneedling that penetrates the top layer of your skin. So that will, rejuvenate the skin as well and promote collagen synthesis on top, on the surface. So if you see, there's the needles coming out, and then the green light indicates that the RF is also activated, or the heat. So let's start. Okay, so finally we're done. I did 500 shots of RF microneedling, and this is actually the final product. So you see, it's just parang na-ano ka lang, na-blush ka lang, nag-workout ka lang. There's no blood, no swelling is very, very minimal, which should improve in a day's time, 1 or 2 days. Then you should be fine. So there. Usually I do the TCA cross, as I mentioned, around 6 to 8 weeks. And RF microneedling, we can do this monthly. Okay. Thank you. Bye.